Hello there, everyone. Dr. Tharp here. And as I say, I am on a mission to reverse type 2 diabetes naturally to help those who are struggling reverse type 2 diabetes naturally. Um, so let me just get this thing to the side here. All right. So I am, here tonight because I want to inspire everyone here who is struggling with type 2 diabetes. I want to help everyone understand that you can absolutely reverse type 2 diabetes naturally. In fact, the natural approach is actually the first line to reversing type 2 diabetes. Let me just fix this light. So what do I mean by that? So when you were first diagnosed with type 2 diabetes, your doctor told you, your numbers are high, you're looking at starting metformin, and then, you guys discussed, you bargained with your doctor, okay, I'm not going to start metformin just yet. I would rather try the natural approach. The reason your doctor allows you to do that is because the natural approach is the first line treatment. The problem is that doctors nowadays do not have the time to put into counseling you about how you can reverse your diabetes naturally. They don't have the time to, spell things out for you. So, unfortunately, the next best thing that they do is to write a prescription. And I know many of you here do not want to be on prescription medications. Many of you here are actually wanting the natural approach. And many of you here are really, really desperate because you're feeling sick. You're feeling the symptoms. You are feeling it destroy your body slowly. And you're terrified because you've watched family members go through the same thing. So that is why I, as a doctor, has taken it on as my mission to help those out there understand that they can reverse diabetes naturally. It is doable. Of course, you have to have the right strategy. You have to do it the right way. Now, for those of you who don't know me, I am an internal medicine physician. I'm board certified. I started out my career as a hospital doctor. So I routinely see people in the hospital setting with end stage diabetes. And when I say end stage diabetes, what do I mean? So, diabetes is in fact a progressive disease. Okay. It's not a disease that is just going to be there doing no harm to your body. The minute your blood sugars are in the abnormal range, it is destroying your nerves, your eyes, your heart, your brain. It's literally touching every single organ in your body and wreaking havoc on every single organ in your body. It is a progressive disease. So, unfortunately, the minute your blood sugars are running high, and in fact, if you are insulin resistant, meaning your blood sugars aren't even abnormal yet, you are having significant damage. Okay. So that's an important point. So that means it's progressive. How do you know it's progressive? If you're already on medications, that's a sign it's progressive. Okay. If you have been, 2 years ago, a year ago, 6 months ago, you were told by your doctor that you had type 2 diabetes or that you had pre-diabetes rather. And now you're being told you have type 2 diabetes, there is your proof that it is really a progressive disease. So, as a hospital doctor, I see the end stages of it. I see the amputations. I see the heart disease. I see the strokes. I see the severe neuropathy that happens as a result of type 2 diabetes. So, type 2 diabetes is basically an illness that steals your quality of life, it steals your sense of well being, it keeps you sick so that you really can't accomplish the bigger things in life. You can't explore your full potential when you are struggling day to day with type 2 diabetes. So I saw that in the hospital setting on a day to day basis. I've held the hands of people who were losing limbs and whose lives were changed forever. And that inspired me to take a step back and reassess how I was practicing medicine. And that's when I decided to form this practice that's very much focused on the natural approach to reverse type 2 diabetes. And I'm completely confident in the approach that I have because it's science backed, it works. And this is the approach that your doctor gives you, the chance that your doctor gives you in the beginning is actually that natural approach that the doctor is expecting you to do, but unfortunately, you don't get the right guidance. And that's why many of you here are skeptical, right? You've been told type 2 diabetes can be reversed naturally, but you've tried so many things. You've tried the supplements, you've tried the diets, you've tried cutting out carbs, you've tried intermittent fasting, and none of that is working for you. And that is because you did not have the right guidance. So that is why I do what I do. And that is why I get on here, almost every night to share some pearls. So if you have questions, if you are having a particular struggle, please feel free to put it in the comments. Put it in the comments, and I will be happy to address any questions that you have. Any concerns that you have. And again, every time I do this, the goal of this live, the goal of this talk is to inspire you to take action. So when you walk away from this live, don't just sit in despair. Don't sit in type 2 diabetes. Just know that you can, in fact, reverse it. And it's all about taking action, but the right action. So tonight, I wanted to dedicate some time to what do your blood sugars mean? And let's take it even a step further. What does your hemoglobin A1C mean? So let's start with blood sugars. Your blood sugars, a normal blood sugar. Let's start with normal blood sugar. So a normal blood sugar ranges between 70 and 100. Okay. So if you are sitting there every day, your fasting blood sugar is in that range, you do not have type 2 diabetes. Okay. Many of the people I work with, we are working towards getting them steadily within that range. That is the range we're working towards. If you have a blood sugar that is greater than 100, between 100 and 100, between 100 and 125, then you are sitting in the pre-diabetic range and you're in the danger zone. It means that you are very, very, very close to being called a type 2 diabetic. And if you do nothing about it, then what that means is that you are well on your way to type 2 diabetes. So, again, if you have pre-diabetes and you're listening here tonight, that's not a coincidence. This is your sign to take action and to take the right action. I can't stress that enough. Take the right action. And we're going to talk about what the right action is shortly. But first, let us talk about the blood sugars, right? Now, if you are sitting with a blood sugar over 125, then you are in the type 2 diabetic range. You are a diabetic. And what that means is usually the blood sugars, if the blood sugars are in the abnormal range period above 100, it means your body is already going through significant damage and you're probably having symptoms. Very likely, if your blood sugar is in the abnormal range above 100, even in the pre diabetic range, you're experiencing fatigue, you're experiencing difficulty losing weight, you're experiencing a growing midsection, right? You're experiencing that stubborn belly fat, you're experiencing the cravings. So you are already experiencing significant symptoms from from pre-diabetes once your blood sugar hits the abnormal range. So it's really important, number one, to recognize that. Don't live in denial. Don't say, oh, I'm going to be just fine. Don't say, oh, I'm going to be fine. My blood sugars are okay. Don't do that because at the end of the day, you are going to suffer the consequences. Let me just hook up my charger here. So it's really important that you take action. Oops. And then let me get my light up and running. So it's really important that you take action. Sorry, guys, my charger is gonna go dead here. Okay, good. So we're up and running here. All right. So if you're in the pre diabetic range, it's really important you take action because at the end of the day, it does catch up with you. Okay. So that's the first thing. Now, the second thing is no. Okay, I'm sorry, guys. It's kind of an awkward setup here. But it's really important that you take action first and foremost. So, action is the key thing. Now, if you are sitting in the diabetic range, what that means is now you are in the danger zone. So, if your blood sugar is above 125, then you are now hitting that point where you're not just feeling fatigue, you're not just feeling the cravings, you're not just feeling the stubborn belly fat, but what you are experiencing as well is neuropathy. You're experiencing the burning and tingling in your hands and your feet. You're experiencing the vision issues. Now, those are significant symptoms because once you're experiencing that, what that indicates, I know that's very uncomfortable. For those of you who are suffering with neuropathy, I understand it's an incredibly debilitating issue to have. And that too is progressive, it's irreversible. So, if the minute you start to feel any kind of sensation in your hands and feet, it is important to heed the warning and to act. Now, the other thing, the other alarming part of experiencing symptoms, tingling in the hands and feet, is that very likely internal damage is happening, damage that you don't even realize is happening. So, for example, your kidneys, type 2 diabetes is the number one reason for dialysis in this country and worldwide. So it's doing very silent damage to your kidneys. You don't know it's happening until your doctor starts to tell you that your kidney number is abnormal. Once your doctor is saying, oh, your kidney number is abnormal, we have to keep an eye on that. Again, alarm bells should be going off. It's more urgent than it seems, right? In the healthcare setting, unfortunately, we almost normalize the side effects of type 2 diabetes. We say, oh, don't worry about it. We'll just monitor it. And the reality is that is where your alarm bells should be going off. And that is where action, action, action is critical. Okay, so again, once you're starting to have any symptom at all, it means internal damage is happening. So it's important to take action. So, what is the action that I'm talking about, right? I keep saying here that many of you have tried so many things. Some of you are actually skeptical here because you've tried so many things and it just hasn't worked. Well, the strategy has to be the right strategy to truly work. And I will tell you what the wrong strategies are. The wrong strategy is going straight for your supplements. Of course, supplements have a place, but supplements by itself will never reverse type 2 diabetes naturally. And take that from me as a fact. It will not reverse your type 2 diabetes. It's really important to understand that so you don't waste time on supplements. So if your doctor gave you 3 months to get your blood sugars down and you bought that supplement online somewhere and it promised to get your blood sugars down to reverse your A1C, remember that is not the way to do it. The number one way to do it is through nutrition. I always say my clinic is your kitchen. That's what I tell my clients. Your kitchen is my clinic. Okay. So that is why the reason is nutrition is key here. Okay. So supplements again will not work by themselves. Do not rely overly on supplements. The next mistake that I see is relying overly on intermittent fasting. Fasting has a place, there's no doubt. Fasting does have a place in reversing type 2 diabetes. But the problem is, many people do intermittent fasting as a DIY, right? You heard, oh, I should fast for 16 hours a day. You heard it from an influencer somewhere. Maybe you heard it here on somewhere on TikTok. And so you do it on your own without any real expert guidance. And the problem there is that you fast in the wrong way. So now your energy drops even more with the fasting because unfortunately, fasting leads to you not nourishing your body enough. You're not giving yourself what it needs. And one thing that surprises many of the people I work with, many of the women that I work with, is that I tell them they need to eat. That is what's surprising. Many people here, and I'm sure many of you here, have spent a lot of time fasting, doing one meal a day, and not, and then in the evenings you're having cravings. You're struggling in this vicious cycle of fasting and having cravings. I know because many of the people who start with me, I actually have to tell them it's time to eat. And as they're eating and nourishing their body, their blood sugars are normalizing. So it's really important to understand nutrition is key, and understanding how to nourish your body appropriately. And in order to nourish your body appropriately, you have to fast the right way. Now, the other mistake that I see a lot is you become vegetarian because you think becoming a vegetarian is going to solve the issue. And you might actually be getting yourself into a lot more trouble by converting to vegetarian diet. If you're already a vegetarian, then I will say that your reversing type 2 diabetes for you is actually a little bit more challenging. And that is why you're frustrated. You're a vegetarian, you're thinking that's going to solve the problem, and it doesn't. And the reality is, you have to understand how to nourish your body in the right way. It's very much difficult to get adequate protein in as a vegetarian, and it's very difficult to get protein in that doesn't have a lot of carbohydrates in there. So that is why becoming a vegetarian might actually make things more challenging. So it's really important, again, to understand strategy. And if you have the right strategy, you'll do it, you will see your numbers respond, like I see every day with the people that I work with. The women who I work with have great responses once they understand how to structure their nutrition around their own bodies. So strategy is key here. Now, I also say that reversing type 2 diabetes is actually a system, right? Nutrition is a huge part of it. It's 80% of reversing diabetes. There's no doubt about that. But there's other things you have to think about when it comes to reversing diabetes. It comes to habits, it comes down to movement, it comes down to understanding how to put those things together. And one of the biggest issues that I see missing is mindset. There's a mindset problem when it comes to reversing type 2 diabetes. Many people, again, just by trying many of the wrong strategies, become frustrated, they give up, they become skeptical that it can be done. And so they lose hope there. And so you're not willing to try that one last thing that works. Okay. So getting past that mindset block is really important. Understanding that your agony, your misery, your suffering with type 2 diabetes can get better if you just move forward with the right plan. So that is pretty much the things that we have to consider when we're trying to reverse type 2 diabetes. Nutrition, number one, it has to be a system-based approach. And the approach that I use is evidence-based. Okay, it's based in science. It's the first line treatment. So when you were first diagnosed with diabetes, remember your doctor gave you a chance. You tried many things, it didn't work. The reason your doctor gave you a chance is because the natural lifestyle changes, the natural approach is lifestyle change, but you just don't have the right strategy. Now, one of the last things that I want to cover is the hemoglobin A1C and what does it mean? We talked briefly about blood sugars. We know the higher the blood sugars, the more devastating the symptoms, the more devastating the complications, and we know that the damage is actively being done in the body. But once you hit the hemoglobin A1C is also another area that is used often to diagnose type 2 diabetes. So if you are between 5.7 and 6.4, it means that you're in the pre-diabetic range. And again, it means you are in a zone that you have plenty of opportunity to act, because if you don't act, you are on a path straight for type 2 diabetes. If you are above 6.5, it means that you are officially diabetic. 6.5 and up, you're officially diabetic, and now that you're on the clock, right? The clock is ticking. The if you're not already experiencing complications, complications will come if you do nothing. So, and then any A1C that's 5.6 or less is in the normal range. So that is what we aim for in, the Reverse Her Challenge. That is the program that I use to help women reverse type 2 diabetes naturally. And that is what we aim for. We aim to drive that A1C down as much as possible within 90 days in a system based approach. So if you have not tried that approach, if you have not had a doctor who has walked you through the evidence based approach, if you have not worked in a very structured environment to help you understand what's happening in your body, to help you understand nutrition, to help you understand exactly what to eat to naturally reverse diabetes, then it means you have not tried everything. And again, this is where hope is. So if you are ready to reverse type 2 diabetes naturally, then the one takeaway I want you to have from this live tonight is that it can be done and you should take action. If you are looking for that structured approach, if you are looking for that one last thing to try, this is it. And so I have my link in the bio. If you want to click that link, it's a Linktree link. There's many things there that you can access, resources to get to know what I do, but there's also opportunity to book a free 15-minute discovery call. So that way we can talk about what we do. We can talk about your specific challenges, and we can talk about action. If you are not ready to take action, then reserve those spots, those 15-minute spots, for someone who's ready to take action. So please don't book and take up a slot for someone who's serious about reversing type 2 diabetes. If you are serious, go ahead, click the link, and book that free discovery call, because again, action is everything. You want to take action so that you can successfully reverse type 2 diabetes naturally and spare yourself the debilitating symptoms, the debilitating complications. Save yourself the hospitalizations, the doctor's office, the mounting medications, more and more medications. And again, as a hospital doctor, I see that routinely, and that is why I do what I do, is to save people from a really miserable end. I say that, I always say, if you take the time to reverse type 2 diabetes naturally, if you make that investment early on, then your future is bright, your retirement is bright, your time with family is bright. You get to do things that you really enjoy, instead of, as you get older, worrying about medications, worrying about your health, in and out of the hospital. That's not how anyone should live. And so that is why I do what I do. So, with that, I am going to close off tonight. I hope I've inspired some people to take action. And I hope that, if you're really ready to take action, go ahead and book that free 15-minute discovery call so we can learn more about you. You can learn more about us. And if we're a good fit, we can move forward. All right, guys, have a good night. All right, guys, have a good night. It was a bit of an awkward setup here, as on multiple lives. But again, if there's any questions or any comments, or if you're ready to take action, go ahead and book that free 15-minute discovery call to find out how you can make the most of your future.